Okay, today we have a topic of palmar arches of the hand. So I'll write here the topic that is known as the palmar arches. Palmar arches of hand. So how to draw the palmar arches? So in order to know the palmar arches, you need to draw here the flexure retinaculum of the hand. So this is the palmar aspect, right? So for that, we have to draw the artery that is known as, this is the medial side and this is known as the lateral side, right? So we'll draw an artery here that is known as the ulnar artery. So this ulnar artery is passing superficial to the flexor retinaculum. So after crossing the flexor retinaculum here, this artery will give a branch that is known as the superficial branch, and so this superficial branch runs more forwards and turns laterally. So I'm turning it laterally. So this is known as the superficial branch, right? And we have the deep branch also, right? So this is the deep branch here. So let's forget about the deep branch right now. This superficial branch runs laterally, but still this superficial branch, what happens, it is not forming till now the superficial palmar arch. So in order to form the superficial palmar arch, it has to take anastomosis with the other artery. Now how anastomosis takes place, we have to know. For that you have to draw here the radial artery, but this radial artery is directly not crossing the flexor retinum. So this artery will turn towards the lateral side. It passes through the anatomical snob box here, right? And then so from the back side, from here it turns from the anatomical snob box and pierces the first dorsal interosseous muscles here, right? And this artery, right, that is radial artery, comes towards the palmar aspect and goes and attach with the deep branch of the ulnar artery, right? And it forms deep palmar arches. So this is deep palmar arch. Agree? Now, from the deep palmar arches or from the radial artery, gives the branches towards the thumb finger, right? So out of this five finger, the thumb finger is the prince, single, right? So can you say that this artery will be known as the princeps pollicis? Princeps pollicis, right? Now, somehow it also gives a branch which goes towards the lateral side of the index finger. So the name of this artery will be known as the radial side. So radialis indicis, right? So this is how the deep palmar arch and its branches is there. Now, still this superficial palmar arch, what happens here? It goes anastomosis. So now it goes anastomosis either with the princeps pollicis or it goes an anastomosis with the radialis indicis, or what happens here? This radial artery, it gives one the palmar cutaneous branch. So superficial palmar cutaneous branches. So this palmar cutaneous branches goes and attach with the superficial the the palmar arches here, right? So this is known as palmar cutaneous branches of radial artery, right? So this the entire anastomosis is completed here, and which forms superficial palmar arches. So I repeat, this ulnar artery goes laterally and then it anastomosis to the radialis indicis or to the princeps pollicis or to the superficial palmar cutaneous branches of radial artery, and this is how the superficial palmar arch is formed. Now the superficial palmar arch gives three common, this is the one, two and three common, right? So this is common house for everyone, and finally we have to move to the digits here, right? And this is the palmar aspect. Can you name this all these three artery as the three common palmar digital artery, which is a branch of superficial palmar arch. Now again, if this is a common, finally we have to reach here, right? So now this three common palmar digital artery, again it gives up branches here, right, towards the medial side of the index finger, towards the lateral side of the middle finger, again towards the medial side of the middle finger, towards the again lateral side of the ring finger, and towards the again medial side of the ring finger, and towards the again lateral side of the small finger, right? And all these branches will be known as the proper digital artery, right? All this one, two, three, four, five, and this one also proper digital artery here. Agree? Now, the medial side of the small finger is still pending. So from here, directly from the superficial palmar arch, artery will arise and goes towards the medial side of the small finger. So this artery will be known as, it is coming properly from the palmar aspect. That's why we can say proper palmar digital artery. And this is how superficial palmar arch is formed. But still, it takes anastomosis or goes and attach with the deep palmar arch. But how it goes and attach with the deep palmar arch? So for that, we have to know about the deep palmar arch. So deep palmar arch gives three branches: one, the two, and the three. Right? So all these three will be known as this one, and this one will be known as the three palmar metacarpal artery. So this three palmar metacarpal artery is a branch of deep palmar arch. So this is a branch of deep palmar arch, this one deep palmar arch, and this artery goes and attach, or it goes and attach with the three common palmar digital artery, which is a branch of superficial palmar arch, right? Same how the deep palmar arch gives one, two, and three perforators. So this perforator will go on the back side from the deep palmar arch, and these three perforators, all these three perforating artery anastomosis with the dorsal metacarpal artery, right? And if this is the flexor retinaculum, just near the flexor retinaculum, we have the arches that is known as the palmar palmar carpal arch, right? So from here, from the deep palmar arch, it gives recurrent recurrent branch. So this recurrent branch goes and attach with palmar carpal arches, and this is how superficial palmar arch and the deep palmar arch is formed. Let's recap it within 1 or 2 minutes. This is the medial side, this is the lateral side, this is the palmar aspect. This artery will be known as the ulnar artery. So ulnar artery, after crossing the flexor retinaculum, it gives the deep branch and superficial branch. This superficial branch goes in anastomosis with the either radialis indicis or to the princeps pollicis or superficial branch of the radial artery. So this is the radial artery. Agree? And how this this is how the superficial palmar arch is formed. Same how it gives 1, 2, and 3 common palmar digital artery. Further, this common palmar digital artery goes and forms the proper digital artery for the index finger, middle finger, ring finger, and half of the small finger. And again, it gives one direct branch that is known as proper palmar digital artery. Same how we have the deep palmar arches. So deep palmar arches gives branch that is the princeps pollicis artery, right? Right. Same how radialis indicis, and it gives 1,